Hello everyone, welcome to my vlog. My name is Sumaya. I'm a student dental hygiene at Al-Sami College in my final year. And today's topic that I will be covering is dental hygiene and elderly abuse. So let's get started with the introduction. Okay, as we all know that dental care professionals such as dentists and dental hygienists are in a great position to identify and signal the symptoms and signs of abuse. Dental hygienists perform head and neck examination through their extraoral exam for every patient, which gives them the opportunity to identify any abnormalities within the head and neck for every patient. Intraoral exam is also a great tool to look for any lesions and abnormalities within the oral cavity. Great communication skills with the client, along with these two extraoral and intraoral exams, are found to be a great tool in identifying and signaling any suspected abuse. The College of Dental Hygienists of Ontario has given the permission to disclose clients' information without clients' consent when permitted or required by law. Registered dental hygienist is required to make a mandatory report related to any type of abuse, and a failure to report any abuse is considered a professional misconduct. And according to the Personal Health Information Protection Act in 2004, under Section 40, it states that any healthcare professional can disclose personal health information where there is a significant risk of serious bodily harm. Keeping in mind that disclosure of information is not authorized when the harm is only emotional in nature. All right, so the next topic that we will be covering is the signs of abuse. Now, of course, there is so many signs and there's different kinds of signs of abuse for the elderly person. But in general, the main signs that we should be considering in our practice is any delays in seeking dental care or dental treatments after a dental injury or disease has occurred, or any cognitively or functionally impaired elderly persons presents without a caregiver to your appointment. Any radiographic information doesn't match the history of information that has been said by the elderly person during that appointment. These can act as a general signs for abuse. The next thing that we will be covering is the physical signs of abuse and neglect signs. Physical signs of abuse can be shown as loose teeth, fractured teeth or jaws, bruises and wounds, and any painful body movements unrelated to a disease or an illness. And neglect can also be shown by showing excessive amount of plaque, by having untreated cavities, the client being very unhydrated, the continuous use of fractured dentures for a long period of time, or a failure to buy medication or does not use the medication properly. All of these can be signs for neglect. So we should pay attention to them when we encounter elderly person in our chair. The next topic that we will be talking about is the screening question. Now, according to the Canadian Dental Association, the following questions can be asked for an elderly person if an abuse was suspected, such as, has anyone close to you tried to hurt you recently? Are you afraid of anyone close in your family? Has anyone tried to call you names and make you feel bad? Has anyone tried to force you doing things that you don't want to do? Has anyone tried to taking things that belongs to you without your permission? Or has anyone tried to tell you you are sick and force you to stay in bed when you're not really sick? So all of these should be good guideline for you to ask questions if you suspect any abuse has occurred. Now, according also to Canadian Dental Association, as a registered dental hygienist, we should ensure to balance between the followings, which are the duty to protect the safety of elderly people and allowing the elderly to engage in the full self-determination of their own treatment. Now, of course, our duty is to respect elderly and treat them with honesty. And our main goal is to improve the quality of life and reduce pain and suffering related to any dental issues. Okay, so the next thing that we will be talking about is the best practice guidelines. Again, according to the Canadian Dental Association, the following can be the best practice guidelines that a dental hygienist can follow with regards to giving care for the elderly. The first one, of course, is avoid causing harm. Respect elderly people and taking into consideration the diversity and culture differences. Recognize the rights of an elderly person to make their own choices about the provided treatment and avoid imposing your opinion regarding those treatments. Involve the elderly person in the developed care plan and obtain a full informed consent based on the client's choices. All right. So, in conclusion, to wrap up the topic, I think dental hygienists play an important part in recognizing abuse due to the nature of their job that they do for every day, and they should report any suspected abuse. And Ontario Senior Safety Line can be contacted to report any suspected abuse. All right, I'd like to thank you guys for listening to my vlog, and feel free to ask any questions in the comments below, or if you feel like I have missed an important information that needs to be added to my presentation, feel free to add that in your comments. And thank you for listening and have a wonderful day.